Hi, my name is Sue Lucas-Smith from the University of Sydney in Australia. On behalf of Anna, Mike and Louise, I will present the case management taxonomy to you. The taxonomy was developed over a period of 18 months from 2013 to 15 for my doctoral research study. I would like to thank and acknowledge the 11 nominal group members, all of whom are experts in case management, who contributed their time and expert knowledge during the third stage in the taxonomy development. We would also like to thank the Lifetime Care Authority in New South Wales for their in-kind support during the nominal group stage. This is the first of 3 video modules. We encourage you to listen to all 3 so that you understand the complete picture. The first video covers case management, the variability and the problems. The second video shows you the taxonomy and how it was developed. And the third video shows you examples of the taxonomy being used. There are many different terms applied to case management and the position titles for case managers. Often the term case manager is not used. Maybe no one really wants to be seen as a case, nor would we want to be managed. So from a human rights perspective, the term case management is perhaps not such a fabulous term. Some of the terms that are used for case managers in their roles are service broker, medical case management, community care coordinator and care coordinator or case monitor, or discharge planner, or perhaps support broker, and then there's support facilitator. We could go on. Other terms are planning facilitator or clinical case manager or rehabilitation case management or local area coordinator. There's many terms. And you can probably think of the descriptions in your own context. The question is, are the people in all these roles all doing the same thing? Or are they doing similar actions some of the time? There's a quintessential Asian phrase used to explain similarities and differences, which is same, but different. You might be familiar with it. We know that in all of these terms that there are similar actions or interventions in some of these case management roles, but there are also differences. And certainly there's a gap of knowledge and lack of international consensus on case management, including a definition and the components of case management. So it's really important to know what is case management, but also what is not case management. So what are the factors that make these roles and the case manager's actions different from each other, and what are the similarities? First, there is the theory underpinning the case management approach, or if you like, the model of case management. So what we're going to do is use an analogy from Diamond and Cantor in 1988. Rosen and Thiessen cites Diamond and Cantor. So we have an analogy of case management. So think of case management as a type of travel agent, or then you can have a travel companion, or indeed you can have a travel guide. So what are the different models behind these different roles? So let's take the travel agent first. A travel agent is a bit like the case management broker model of case management. They coordinate the pathway. They're not particularly involved with you as a person. A travel agent usually sits behind the desk, and the client says where they want to go, perhaps the style of accommodation, and the travel agent books the flights and the hotel. So the travel agent knows a lot about specific services, more about what contacts and deals they have and what they can offer you. And so it's fairly service oriented rather than being person centred. A travel companion is somebody who accompanies you on your travel. So it's sort of like an experienced support worker or support facilitator. So the travel companion is person centred and very individualised. They accompany you sightseeing where you want to go, but they don't necessarily have the experience of the activity or place where you go. If you're going with a travel guide, they're a mixture of the travel agent and travel companion, and much more like a community-based case manager. So the travel guide has a particular style of travel and might ask you what you'd like to see, what you're interested in, and they develop a personalised itinerary, and they do accompany you on specific sectors or sightseeing. The travel guide can act as an interpreter and explain more detail about the particular site you're seeing, and often stories around it. They generally get to know you a bit more, and they often give you choices of what you want to see and might change that en route. So although it's planned, it might change depending on how you're feeling that day. The travel guide is experienced and has expert knowledge of the country or the places. Of course, in the world of case management, there is everything in between all these roles. Some of the theoretical models in case management are strengths-based, broker, clinical, assertive case management, rehabilitation case management, and there are a number of others. But what are the other factors that result in the variations in what case managers do? Well, there's the jurisdiction, the context in which the case manager operates. For example, there's injury-related traumatic injury or insurance jurisdictions. There's also vocational rehabilitation or jurisdictions specific for particular health conditions such as mental health. There's also corrective services or veteran affairs, and case managers are also present in the legal system to steward a person through the courts. Another difference in case management is the discipline and training of the case manager. A case manager may be an occupational therapist or a rehabilitation counsellor or a social worker or a nurse, speech pathologist or physiotherapist or a welfare officer. Yet another factor is the case management service context and how the role, the actions and responsibilities are interpreted. The geographical differences between a service in an urban area, for example, versus a rural one, the funding of the case management services, the number of employees that the service has, whether it's in an acute or non-acute setting, whether it's mobile and the intensity of the interventions. Then, of course, case management also varies depending on the client or the case manager recipient's health condition, their environmental and personal context. So we can see that there is huge variability in case management with multiple interdependent and interacting components. So why is that a problem? Well, if we don't have a common language to understand and unpack case management, we don't really know what it is and what it isn't. So we can't make comparisons to work out what works or what is effective or what is best practice. Or how do we work out what case management interventions are the most effective and the cost benefits? Ultimately, in policy development, planning and management of case management are all hindered if we don't fully understand case management. We have had a look at the complexities around case management. Let's now look at taxonomy. A taxonomy is a kind of knowledge map. Let me explain using an example of a taxonomy of animals. In Australia, we have many unique native animals, but we're going to talk about two. The koala, which is an animal that spends lots of time in a tree and eats leaves. The baby koala is born live. The second native animal is the platypus. The platypus lives in water, has a bill like a duck and webbed feet. The platypus is a carnivore and their young develops in an egg. The platypus and the koala have plenty in common. You wouldn't think so when you think of one living in a tree and a vegetarian and the other living in water and a carnivore. But as you can see from this animal taxonomy tree of mammals, both the koala and the platypus belong to the tree because they have hair, mammary glands and a neocortex. But they belong to different arms of the mammal tree. You can see the koala belongs to the theriforms, the live-bearing mammals, whereas the platypus belongs to the monotremes, egg-laying mammals. So a taxonomy helps to explain the components and the relationships and also defines the components for a common language and understanding. In this first of the 3 video modules, we have explored case management, the variability and the problems. You can now move on to the second module to learn about the case management taxonomy. In the third video, we show you examples of using the taxonomy.